Women who have struggled to get pregnant and now take GLP-1 drugs like Ozempic are getting pregnant.
GLP-1 started as a diabetes medication.
Ozempic, Wegovy, Mounjaro, Zepbound, these drugs are showing surprising potential.
It evolved into a weight loss solution, and now scientists are discovering that they hold even greater potential.
This is a scientific breakthrough, and not just because of weight control, but because of cardiovascular risk reduction, treating diabetes.
From heart disease to kidney disease, like the potential for these drugs, I think, only keeps growing.
In fact, they're on track to become one of the most powerful medications we've ever seen.
If we can leverage these tools with really good healthcare, it's going to help us become a much healthier country.
Hey, I'm Ashley. I started taking a GLP-1 to treat my PCOS, and as a result, I lost over 100 pounds in 12 months. And it's helped me reclaim my hormone health. Welcome to Shapeshifting. Why are GLP-1s so powerful? Scientists are starting to uncover that these drugs could have far-reaching, life-changing impacts beyond diabetes and weight loss due to their effects on the metabolism, inflammation, and reward systems. These three key areas are involved in many health conditions and illnesses. We're talking about potentially tackling issues that we've been grappling with for hundreds of years: sleep apnea, addiction, even memory loss, and cancer, and new issues like post-COVID brain fog. Many of these remarkable findings are being made in unexpected ways, and it's important to understand that these discoveries often stem from observing current users taking the drug for diabetes management, and more recently, for weight loss. In the world of science, discovering additional benefits in this way are rare and exciting for experts. But many of the topics in this video require years of additional research before they can be considered a confirmed benefit. Today, we're diving deep into the emerging ways that GLP-1s might enhance your brain power, help kick your destructive habits, and even revolutionize women's health. Okay, let's start with cardiovascular health. While it's a newer benefit compared to diabetes and obesity, it's already well-researched and continues to expand with new potential. Some GLP-1s have already been approved as a way to protect heart health, and for a really good reason. They lower blood pressure, cholesterol, and triglycerides, and improve glycemic control, which manages blood sugar levels. Personally, I have dropped my cholesterol by 100 points since starting a GLP-1. Altogether, these effects reduce the risk of major cardiovascular events, including strokes and heart attacks. So far, studies have found this to be true in patients with type 2 diabetes and patients who are overweight or obese. Both groups are at high risk for cardiovascular disease. One study on over 17,000 overweight and obese patients with cardiovascular disease showed that taking a GLP-1 reduced the risk of major cardiac event by 20%. Imagine the impact on millions of people who are struggling with a condition that put them at much greater risk for heart disease. A 20% reduction in heart attacks or strokes could potentially save countless lives and alleviate the strain on healthcare resources. In light of these results, the FDA has approved the use of some GLP-1s to reduce the risk of major adverse cardiovascular events. In addition to the heart, GLP-1s may impact impulse control. This seems to result in a decrease in reward behavior, which is a cornerstone of addiction. Scientists are still working to uncover the direct mechanism, but they believe that GLP-1s could modulate brain circuits and alter the dopamine reward pathway. Not only can they reduce food cravings, but animal studies have found that GLP-1s led to a reduction in the use of alcohol, cocaine, amphetamines, and nicotine. Just like with any substance dependence, food addiction is also something many people struggle with. Human clinical studies are ongoing, but the results so far are promising. For example, one preliminary study found that participants who took GLP-1s experienced a 40% reduction in opioid cravings. GLP-1s might help us in ways we never imagined, but it's also important to remember that weight loss alone can lead to significant positive effects. Obesity is a major risk factor for obstructive sleep apnea. You can see here, excessive weight around the throat and airways can cause tissues to collapse and obstruct breathing. This interrupts sleep with episodes of reduced oxygen intake or stopping breathing altogether. For these patients, taking GLP-1s can greatly reduce the number of these episodes each night, providing them with a more restful and healthy night's sleep, which is essential for weight loss. In one clinical trial, patients already using a CPAP breathing device experienced a 63% reduction in sleep apnea events compared to those not taking a GLP-1. Because these studies were so successful, the manufacturers of the GLP-1s are now working to add sleep apnea to the drug's FDA-approved indications. One promising effect relates to polycystic ovarian syndrome, better known as PCOS. As someone who started taking a GLP-1 to treat my hormonal imbalance and infertility, I know firsthand that this is a complex hormonal disorder. PCOS affects approximately 1 in 8 women of reproductive age. It manifests in a variety of ways, with symptoms including irregular periods, infertility, weight gain or difficulty losing weight, excess hair growth, acne, and thinning hair. However, PCOS is not limited to a specific body type. Women of all shapes and sizes can experience it. Research shows that GLP-1 receptor agonists can help address some of the underlying issues associated with PCOS. By improving insulin sensitivity and reducing androgen levels, these treatments can restore menstrual regularity and increase the chances of pregnancy. Studies suggest that GLP-1 receptor agonists may act as key modulators between the metabolic and reproductive system. This means that beyond just the effects of weight loss, GLP-1 could play a key role in regulating how our bodies balance reproductive health and metabolism, potentially opening new pathways for treating fertility issues related to obesity and hormonal disorders. For many women, managing PCOS can enhance overall well-being, promoting healthier cycles and more energy and a better quality of life. However, while GLP-1 receptor agonists show promise in managing PCOS symptoms and improving metabolic health, their effects on pregnancy are not yet fully understood. Right now, healthcare providers are recommending discontinuing GLP-1 treatment for at least 2 months before trying to conceive. By addressing obesity, GLP-1s may also decrease the risk of certain cancers, specifically obesity-associated cancers, where the presence of excess body fat has been associated with a higher risk level. In a study of over 1 million patients with type 2 diabetes, researchers found that patients taking GLP-1s had significantly lowered their risk of developing 10 of the 13 identified obesity-associated cancers compared to those taking insulin. While preliminary, these findings demonstrate that GLP-1 receptor agonists could play a role in cancer prevention for individuals at a high risk. By addressing obesity, a major risk factor for multiple cancers, GLP-1 medications not only improve metabolic health, but may also reduce the incidence of obesity-related cancers, such as postmenopausal breast, colorectal, and endometrial cancers. With obesity driving the prevalence of 13 cancer types, sustained weight loss facilitated by GLP-1 treatments holds promise in lowering these risks, enhancing both overall health and cancer prevention outcomes for vulnerable populations. Scientists are uncovering promising neuroprotective qualities of GLP-1 receptor agonists, showing potential cognitive benefits beyond their use in metabolic disorders. Research suggests that these medications may prevent age-related neurodegeneration, enhance neural growth, and protect neurons from damage and cell death. Small studies have found that low levels of GLP-1 are associated with mild cognitive function impairment in patients with type 2 diabetes, and that treatment with GLP-1 medication improves some brain function. Early research also suggests that these drugs can slow the progression of neurodegenerative diseases like Alzheimer's by reducing brain volume loss and preserving cognitive function. Similarly, patients with Parkinson's disease have also shown long-lasting improvements in both motor skills and cognitive abilities following GLP-1 treatment. A treatment that can slow cognitive decline or enhance brain function could dramatically improve the quality of life for patients and their families. Imagine the impact of a treatment that not only manages diabetes, but also helps maintain brain health as we age, potentially allowing people to stay independent longer and reduce the need for intensive caregiving. It's been over a decade since GLP-1 receptor agonists were first approved by the FDA to manage type 2 diabetes, yet we are still uncovering their vast potential across multiple areas of health. What excites me most is that we're just scratching the surface. Many of the benefits we've discussed have emerged almost by chance. As we continue to study and understand these drugs, it's becoming clear that their impact could extend far beyond what we could have ever imagined. transforming how we address chronic illnesses and improve quality of life for millions worldwide. Was there a GLP-1 benefit that surprised you? Drop your thoughts in the comments. We might just tackle them in an upcoming episode. If you found this video helpful, don't forget to give it a thumbs up, hit the subscribe button, and turn on notifications so you don't miss our latest content. Thanks for watching Shapeshifting.
1 in 8 American adults say they have taken a GLP-1 drug.
The potential for these drugs, I think, only keeps growing.
What if major world diseases became small footnotes in history books? This might sound like science fiction, but it's not.